Dr. Sibongile Walaza is a medical epidemiologist at the National Institute of Communicable Diseases. So she joins us now in the studio. So we're trying to understand the science behind this coronavirus. A lot has been said. The health department has been at pains to try and explain what is real and what is not. Let's first start with when it was first detected and what cluster of diseases this coronavirus falls within.
So the coronavirus is a group of viruses that cause illnesses both in animals and in humans. So we do have some that cause disease in humans, and those ones cause just normal flu-like symptoms or cold. But then sometimes it happens that a coronavirus that normally causes disease in animals, then it changes in its genetic structure and makes it possible for it to infect humans.
So it mutates?
Mutate is not, I mean, it undergoes a change.
Yeah. Changes in characteristics.
Yeah, it changes in characteristics, and then makes it able to infect humans. And sometimes then there's an intermediate host. So maybe the first part it infects, for example, a bat and then a camel, and then when the human is in contact with the camel, then they get it. That was the case with the MERS coronavirus that was in 2012. That was detected mostly in the Middle East. And then the first one of the coronaviruses was in China again, and that was in 2002 to 2003. That one also caused a lot of illness, but it was from a bat to a civet cat, and then contact with humans then causes disease. And then when this happens, then because the human, it's the first time it's happening to a human, and then that's we call it a novel coronavirus, because we're seeing it for the first time, and at that time then you don't know much about the disease, and then you just have to again look at the condition and see how do people, who gets infected, and how do people respond to it.
So I want to talk about, and you say it's a novel coronavirus, and as you mentioned, the types of diseases that fall within that. So I want to talk about in South Africa itself. When did we know about it? Because I saw some reports suggesting that by 2017 already we were aware of it.
By 2017?
Yes, but it didn't have a name. That's some of the reports are suggesting.
Not that I know of, so I don't know where those reports are getting it from, but as I'm saying that this one is, again, it was picked up from a cluster of patients that were in China, and that was in December 2019. And then it was
some of those reports are not true then?
As far as I know, no, they're not.
Okay, so let's talk about the characteristic of the disease. And when I asked whether it mutates, and you're somewhat cautious about using that term, but ever since it was discovered in China and the manner that it has continued to infect people, has it changed characteristics?
Not really. I mean, it hasn't really changed. But I mean, you're talking about mutation. What happens is that with viruses, because they change quickly. I mean, they've got the genomes, which is a structure, a long structure. But as they multiply, then in that process, they make mistakes. So then it's not the same pattern as it was before. But sometimes these are small mistakes. Then there are slight changes, and those changes can also affect how then the virus infects other people, and also again how that virus, when they are infected, respond to it.
And I'm asking because we've seen like all of these pictures that we see from the graphics, and I see that it's a spike proteins, as they put it. So just trying to understand how it moves from, say, as you mentioned earlier on, from there's 4 animals. There was a dog that was found to have the coronavirus in China, and how it presents itself in humans as a primary host.
So yeah, say that again.
So how does it present itself as symptoms, as you mentioned? Yes, you know, in China there's a dog that has coronavirus. So then there are all kinds of myths that you can get it from animal hosts. And I remember speaking to the African Center for Research that they were saying that no, there was one that was found, a bat with similar SARS characteristics, but not necessarily the coronavirus.
So as I was saying earlier, that I mean, then it's most of the time it's the viruses that cause disease in animals. But then again, with all that, when it changes the structure, then it's sometimes affect the intermediate host. So in this case, I mean, number of animals have been mentioned. One of the latest one is the pangolin, that then it infected the pangolin and then contact with the pangolin. But again, because it's a new disease, we're still trying to find out exactly what, I mean, in terms of transmission. And then with people, when they are infected, then they present, again, it's a wide spectrum. They can be mild symptoms and then more severe symptoms. Previous coronaviruses like the SARS and the MERS, then there were more severe cases. Whereas in this one, we see most of the cases, about 98% of them, or what has been reported so far, it's mostly mild symptoms like fever and respiratory
If we're talking
illness.
about that, I mean, people have been advised to wear a mask, or we see people wearing masks. Does it prevent the next person from being infected if somebody wears a mask? Are masks designed to contain?
So a mask, I think I mean, if you think of how it's spread, because we're saying it spreads by respiratory droplets. So if someone coughs or someone sneezes, and then those droplets, then if they fall next to a person, that person can be infected. Or if they fall into a surface and then someone else touches that surface, then can be infected. So what a mask does is that when you've got a mask, only for the people who are symptomatic, not for people who don't have symptoms. So if someone has got symptoms and they've got a mask, then it causes a barrier between the person who's sick and the next person, so that you're protecting the next person from getting the illness.
So if somebody doesn't present symptoms, because we heard that there was a woman in Sichuan who was in the hospitality industry, was tested negative 8 times before she was positive. So if somebody doesn't present symptoms, they're tested and they let go. I'm trying to understand the incubation period. Can somebody still get the coronavirus from somebody like that?
So like most diseases or infections, right, you mentioned correctly that they've got an incubation period. So it will be when the next person gets infected and the time it takes for them, the virus, I mean, to incubation for them to be infected, to pass on the disease to the next person. So it's a range. It's never a cut-off time that say the incubation period is going to be 4 days or 3 days. There is a range because, again, it depends on the host. Sometimes the host, when I'm saying host, is the person who's being infected. If people have got, maybe, for an example, influenza, people who've got low immunocompromise, so then they sort of incubation period is sort of longer and sometimes they shed for longer. So for this one, we're saying it's a range and it's between 2 days and up to 21 days. So in that period, some people will present symptoms in that period, but there's been...
So very quickly, Doctor, what are the myths around this disease so that people out there are educated? How can you not get it?
How can you not get it? Okay, so I think there's been, for example, I can say that at the moment, there is no treatment. There's no treatment that cures the virus or the illness, but then there is treatment that people can take to alleviate the symptoms. So, I mean, you've seen things around in the social media that this cures it and that doesn't cure it. So that is a myth. There is no treatment at the moment. You can treat the symptoms. Again, in terms of severity, I think that's one myth, is that everyone is going to die or it's going to be chaos. At this point in time, what's important is for people to understand that majority of the cases are mild, but you do have severe illness.
All right, thank you so much for speaking to us and giving us a sense of the disease. Dr. Sibongile Walaza, medical epidemiologist at